what's the earliest age then that you think you guys are kind of, when you get those 6 month olds in earlier and you're able to follow their kind of clinical course, what are some of the first signs that you guys will see in these kids?
Right, that's an interesting question, right? When you think of Duchenne, we're always thinking of muscle
Hmm.
weakness and Gower sign. Um, it's important to know that dystrophin is also present in brain.
Hmm.
So some of these kids actually have early on some behavioral problems. They can have attention
Hmm.
problems. You may kind of see future similar to autism spectrum disorders when they're around maybe 12 to 18 months already. So sometimes, those could be your key findings to suspect. So I always tell to our residents and all the pediatricians that I work with that if you see a 12-month or 18-month-old boy, especially with autism spectrum like features, always suspect DMD, and it's you can easily do a simple test at your office. That's your CK, creatinine kinase, which is always high in 10,000s to 20,000s in these boys. Um, so I think those are the early signs that you may want to look at when you see these kids.
Yeah, yes. I mean, that's super interesting. It's not just a muscle weakness problem, like you're
Right.
saying, but so much of it is, the developmental delays alongside that, with behavioral and cognitive delays there as well. So that's super important. That's awesome and something that I think a lot of us don't think about. So I think that's one thing we can be looking for in our younger kids. But as a pediatrician, for those younger kids, is that kind of the best thing for us to be doing screening wise with these kids? Is looking at some of our more, you know, tools across the board to just be doing early developmental screening, and kind of just keeping this on our radar?
Yes, I would agree. You're already doing developmental screening in these
Hmm.
kids, right? Based on AAP recommendations, or that's just part of your routine visit. And if you could just add on this one test to these kids who you suspect having autism spectrum-like behaviors, that would be really helpful for early diagnosis of these boys with DMD.
Yeah, we were talking a little bit about, screening across these younger kids. And so it sounds like, the kind of when we're really trying to pick these kids up younger, one developmental screening, like we were mentioning, is huge for these kids because we're already doing it. And then you were kind of saying too, just making sure we're keeping in mind the cognitive and the developmental delays that come alongside early in these kids. Is there anything else from a screening perspective in these younger kids that you think is just really, really important for us to be watching for? Or then does it really kind of trickle in? How do those kids trickle in into the older kids, and how do we need to be screening those kids differently?
As far as the older kids, it's your typical presentation, right? More of a motor delay, especially gross motor delay than others. Not all patients or not all boys with DMD would have cognitive delays or behavioral problems. But those can happen. As when you go into this age group of 4 to 5 years old, it's more of your typical weakness, motor delay, difficulty climbing stairs, difficulty getting up from the floor. They may not be able to walk as fast as their peers, run as fast as their peers. So those are some of the things that you may want to look at.
Yeah, yeah. And is there anything, the other buzzwords we talk about Gower sign and those kinds of things that are your med school buzzwords for kids. But the other things that you see that are those big words, are things like, the calf pseudohypertrophy and that kind of stuff. What ages are you really starting to see physical exam findings that we can be looking for in a lot of these kids?
Right. It's a good question. It's very variable. We talk about the typical Gower sign in medical school. Of course, like you said, in pediatric residency, you may not see that full Gower sign. As early as 4 or 5. It may take a couple of years. You may not see them until like 6 or 7. So I would probably say partial Gower, or just at least try to. You would, from your experience, you would know they're probably using a little bit more pressure, more
Hmm.
effort to stand up from the floor. Calf hypertrophy, again, that's not a common thing that you would see already at age 4 or 5, because that takes some muscle to destroy and get into sort of hypertrophy phase to see that big calves. Again, that also takes some time. I would probably say 7 or 8. The age 4 to 5, by the time they get to you, the main things would be just um, some sort of abnormal gait, like they waddle when they walk. Very subtle things. They have some difficulties climbing stairs, some difficulties getting up from the floor.
Yeah, awesome. So, I mean, it really sounds like the younger population of kids then, really just making sure we're watching for, small gross motor delays, things we're not doing alongside other kids, and then those behavioral things alongside of it as well as our cue. And then as we're kind of getting a
Yes.
little bit older, really looking for more of those just gross milestone delays, but do not put the pause on it just because we don't find physical exam things, and
Right.
make that be our stop necessarily.